Louise Aronson, Elderhood, Redefining Aging, Transforming Medicine, Reimagining Life. In Elderhood, Redefining Aging, Transforming Medicine, Reimagining Life, Louise Aronson explores how society's negative perceptions of old age lead to biased opinions regarding older adults and insufficient care. This book delves into the importance of changing the way we talk about aging to dismantle age-related biases and create a more vibrant and fulfilling experience for our elderly population. Topics explored include aging stereotypes, ageism, relationships during old age, the flawed healthcare system, and the consequences of prescribing multiple medications for older people. Ultimately, Aronson seeks to redefine old age as the elderhood, celebrating the wisdom and experience that come with it.
Embracing elderhood. Aging often leads to negative stereotypes, such as frailty and feebleness. However, changing our perception of aging can help us recognize and appreciate the vibrancy and wisdom that comes with old age. By redefining old age as elderhood, we can begin to dismantle these biases and better serve the needs of an increasingly diverse older population. Each year, Professor Guy Mico, of the University of California, Berkeley, asks his medical graduate students to reflect upon their associations with the word old. Common responses include words like wrinkled, bald, bent over, frail, and feeble. These associations fuel a bias that equates aging with a decline in physical health and abilities. This bias arises partly from historical unfamiliarity, since most people in the past didn't live long enough to reach old age. As a result, humanity has dedicated more time to studying children and younger adults. Today, however, with baby boomers reaching retirement age, the older population requires much more attention. One issue contributing to this bias is the lack of diverse classification for older people. The U.S. Government Center for Disease Control, CDC, currently has 17 age subcategories for people under 18 and 5 for adults, but everyone over 60 falls under one category. This implies that there's no difference between a healthy 70-year-old and a debilitated 90-year-old, leading to inadequate care for many older individuals. Louise Aronson suggests that changing how we talk about aging is crucial to dismantling this bias. A crucial step is utilizing the term elder instead of old. When asked about the word elder, people associate it with wisdom, power, experience, and knowledge, all positive traits. Aronson believes we should replace the term old age with elderhood, recognizing the valuable knowledge and experience that comes with reaching old age. By embracing elderhood, we can not only appreciate older individuals' contributions to society but also provide better care and understanding tailored to their diverse needs. Embracing aging with happiness. Aging does not equate to diminished happiness. Quite the contrary, many individuals above 65 find life to be fulfilling and enjoyable. Society's negative views on older people, accompanied by the outspread ageism in Western countries, is the bigger challenge. By acknowledging and understanding that old age is an inevitable part of life, we should learn to treat our elderly population with kindness, respect, and dignity. When 93-year-old sportswriter Roger Angell said, "I feel great," he wasn't an exception to the rule. Many older individuals share a similar sentiment, and studies from the United States and Western Europe validate this by revealing that people over 60 possess levels of well-being comparable to 20-year-olds, and the levels keep growing with age. Despite this, elderly individuals often face negativity from society, encountering derogatory terms like old fart or geezer. The condescending language used towards older people is a representation of the ageism deeply embedded in our society. Coined by gerontologist and author Robert Butler in the 1960s, ageism remains prevalent in the United States. This is due, in large part, to the cultural fixation on success and youth, which devalues wisdom and experience in favor of qualities like speed and efficiency. To exemplify this, an older professional may decide to hide signs of aging to avoid the perception of being over the hill. Such a mindset only serves to uphold the damaging belief that old age is something undesirable. By ignoring or dismissing the reality of aging, society denies elderly individuals the recognition of their existence. As author Ursula K. Le Guin so eloquently stated, "To tell me my old age doesn't exist is to tell me I don't exist." It's essential to recognize that aging is not a disease, but a natural part of life's journey. Embracing this fact can lead us to treat older people with the kindness, dignity, and respect they deserve. Uncovering happiness and health. Harvard psychiatrist Robert Waldinger brings attention to the importance of relationships for happiness and health. Quality relationships and a strong sense of purpose contribute to greater well-being. However, current healthcare systems, particularly nursing homes, often fail to address social needs, leading to detrimental effects on elderly patients. In a thought-provoking TED Talk, Harvard psychiatrist Robert Waldinger asks, "What makes us happy and healthy as we go through life?" Grounded in over 80 years of data from the Harvard study of adult development, the answer is quite straightforward: it's all about relationships. Rather than the number of connections, such as the example of Facebook friends, the essence lies in the quality of these relationships. Just a few close and reliable bonds are sufficient to promote happiness. Having a loving, stable partner is also an undeniable asset. Another crucial factor for lasting happiness is a sense of purpose or having a reason to look forward to a new day. Regrettably, the American healthcare system, including nursing homes, often overlooks these vital aspects. Many elderly individuals in nursing homes feel isolated, despite being surrounded by others. Research published in Perspectives on Psychological Science reveals that loneliness can increase mortality by a striking 26%. Hospital-based physicians frequently face challenges when transferring patients to nursing homes. An article published in the Journal of American Geriatric Society in 2017 indicated that doctors are pressured to discharge patients without considering suitable nursing homes, leading to devastating consequences. For instance, an elderly woman named Nita experienced detrimental neglect after undergoing hip surgery and being transferred to a nursing home. She faced malnutrition, severe sores, and limited options towards hospice care. Despite some happy endings in nursing homes, most elderly individuals would prefer to remain in their own homes. Those who can afford in-home care experience greater happiness and health, demonstrating the significance of addressing social needs in healthcare systems. Unveiling age-specific treatments. A young medical trainee learns a critical lesson about treating elderly patients when her assumptions about prescribing antidepressants cause unforeseen complications. The experience reveals the fundamental differences between treating adult and elderly patients and uncovers the need for age-inclusive drug trials. In her initial year as a medical trainee, the author believed that treating elderly patients was essentially the same as treating adult patients. Her perspective changed when she encountered a jovial 90-year-old lady whose deteriorating health forced her to put her sister Bess in a nursing home. Anne's subsequent depression left her unable to eat, sleep, or enjoy activities she usually loved, prompting the author to prescribe an antidepressant. However, the author made a critical mistake: she treated Anne's depression as if she was treating a younger patient. This mistake was understandable considering that until the National Institute of Health's 2019 Inclusion Across Lifespan policy, medical drug trials were not required to include older people. Surprisingly, most people who require such drugs are elderly. Drugs used to treat atrial fibrillation, for instance, often cause confusion in older patients. Yet, these trial-proven drugs continue to be prescribed, despite their potentially harmful side effects. Similarly, the antidepressant prescribed to Anne could cause extremely low sodium levels in elderly patients, leading to lethargy, confusion, or even death. The author only realized this after discovering recently published case reports. Unfortunately, the damage was done, and had been readmitted to the hospital, in need of urgent care, while her son Jack questioned the author's competence. This humbling and educational experience opened the author's eyes to the importance of understanding and addressing the unique challenges that older patients face. The medical community must recognize the need for age-inclusive drug trials and adapt treatment approaches to ensure safe and effective care for the elderly population. Debunking age-related stereotypes. Age is often falsely regarded as a disease, leading to misjudgments and potentially life-altering consequences. A healthy elderly individual can be seen as an exception to the norm, rather than a possibility for everyone. It's crucial to understand that old age is not synonymous with physical or mental decline, as stereotypes can lead to dangerous assumptions in high-stakes situations, such as medical emergencies. An intriguing anecdote involves a 95-year-old man who visits his doctor about knee pain. Upon examining the knee, the doctor asks what the man expected, considering his age. The man retorts that his other knee, just as old, was perfectly fine. This story highlights the unfortunate misconception that age automatically brings illness or discomfort. Viewing age as a disease may result in detrimental consequences. Consider Lynn, a healthy 79-year-old woman, who suddenly experiences unusual behavior, such as disorientation and apathy. Her daughter, Veronica, becomes concerned and calls 911. The paramedics, upon learning Lynn's age and finding no recent change in medication, dismiss her condition as expected in elderly people. This assumption proves detrimental when Lynn experiences a significant stroke the next day. Many elderly individuals suffer from forms of dementia, but it is important to remember that old age doesn't equate to senility. The assumption that old age equals midnight confusion and apathy can lead to grave consequences, as illustrated by Lynn's story. Alarmingly, the paramedics were likely following standard procedures and genuinely concerned for Lynn's well-being. However, their deeply ingrained assumptions about aging clouded their judgment. Lynn's stroke left her forever changed, emphasizing the importance of re-evaluating societal perspectives on aging. By rejecting age-based stereotypes, we can foster a more compassionate and accurate understanding of the elderly, ultimately improving their care and quality of life. The perils of prescribing Cascades. Meet Dimitri, a 79-year-old man suffering from advanced Parkinson's, dementia, and other chronic illnesses. He could barely respond to questions and seemed almost unresponsive. Despite his numerous health issues, his body appeared to be in good shape. Upon reviewing Dimitri's medication list, Dr. Aronson realized that 2 of his drugs were known to have adverse effects on older individuals. He stopped most of the medications and reduced the others, leading to a miraculous recovery. Dimitri experienced a prescribing cascade. He was given medicines to treat side effects caused by other drugs, which only created more issues. Such prescribing practices must be avoided to prevent worsening health conditions in patients like Dimitri. Challenging age-related injustices. The ability to function independently as we age is crucial, but many resources that enable this independence are considered non-medical and are not covered by health insurance providers. In the United States, a confusing classification of treatments versus assistive devices exists, leaving many to bear the burden of costs for items like hearing aids and glasses. This is partly due to a political system backed by industries pushing high-priced surgical interventions. To create a more just society in our elder years, we must challenge the current medical system and societal prejudices that prioritize looking young over providing essential care. The desire to maintain our independence and functional ability as we age often outweighs the desire for a longer life. Losing self-sufficiency, such as being unable to get out of bed or requiring round-the-clock care, can be deemed worse than death for many elderly individuals. Despite this, numerous essential resources that contribute to continued autonomy in aging, like walkers, hearing aids, dentures, and glasses, are frustratingly deemed non-medical in the United States. This non-medical classification means health insurance providers don't cover these vital items, leaving a vast majority burdened by their costs. Wealthy individuals can afford these expenses, and some low-income Americans may have access through Medicaid, but for the most part, people are left to bear a heavy financial burden for essential assistive devices. The perplexing classification of medical treatments versus non-medical assistive devices primarily benefits the pharmaceutical and medical device industries, which financially support political candidates who maintain this classification system. In return, these politicians secure re-elections, making no effort to revamp the system to better support the needs of the aging population. Presently, older adults face a series of injustices fueled by a medical system focused on curing diseases rather than preventing them and a societal obsession with looking young. If we want to improve the quality of life for our seniors, we must challenge these personal and political biases and ensure that essential care and resources are accessible to everyone.
Louise Aronson's Elderhood sheds light on the challenges and injustices faced by the older adult population due to age-related biases, ineffective healthcare systems, and political influences. By redefining the word old to elderhood and embracing the wisdom and experience that come with age, society can create a more inclusive environment for older adults, leading to higher levels of well-being and happiness. The book serves as a call to action for readers, urging them to challenge personal prejudices and advocate for changes that will better support the aging population, and ultimately, future elderhood for themselves.